We're going to turn to India now, and another deadly day along with a record number of new COVID infections. In a country of nearly 1.5 billion people, fewer than 3% have been fully vaccinated. CBS's Chris Livesay reports from New Delhi.
With cases skyrocketing, oxygen dwindling, and vaccines at a trickle, Prime Minister Narendra Modi is under mounting pressure from opposition leaders, even Dr. Anthony Fauci, to impose a strict nationwide lockdown. Exactly how he would do it in a country with 65 million people living in slums is a gargantuan challenge.
Roughly 2 million people live elbow to elbow in New Delhi's slums. In such cramped conditions, social distancing, let alone self-isolating, are virtually impossible.
Take Chand Babu, who lives in this tiny hut with his wife and 4 children. No electricity, no running water, and only one common toilet shared between 5 families, few wearing masks. As for health services,
so no COVID tests, no vaccines, no doctors, no health officials, nobody.
COVID now runs so rampant in New Delhi that it's probably too late for a strict lockdown to actually work, says Princeton epidemiologist Ramanand Laxminarayan.
The lockdowns are helpful when you're imposing it in a situation where there are very few cases.
India's greatest risk is the virus spilling over into the rural hinterland. That's where a lockdown is urgent, he says.
One can't even imagine what's happening out there in smaller towns which just don't have the healthcare facilities.
As for the people in this slum, many live hand to mouth as day laborers. And for them, a strict national lockdown could be just as devastating as the virus. Norah?
Chris Livesay in New Delhi. Thank you, Chris.